This is Eyton Shalom at the Body Mind Wellness Center. I'm going to show you what I'm doing on this young man who has chronic shoulder pain that he's had for years, and he's had an MRI. He does not have a torn labrum or a rotator cuff tear. His problem seems to be related to trigger points activity and muscle in his muscles and shortened muscles as well. You can actually see how his shoulders rotated forward a bit. So this is his third visit, and today we're focusing especially on the upper trapezius. And this is the motor point of the upper trapezius, and this was the fulcrum of his pain that we identified before I put the needles in, hence the surgical ink. So I've released the motor point of the upper trapezius as well as satellite trigger points, all of which are a source of, how did you describe that pain?
It's just like tight and kind of throbbing sometimes.
Mm-hmm.
It's really tender.
Really? Okay. All right. Very good. And so I've already needled that and gotten a very large fasciculation with the muscle. And then here I have done the motor point of the pec minor, which I've also gotten quite a good fasciculation on. But what I do is after I've let the patient rest for a little bit, I then come back and stimulate the motor point again and sometimes get a much larger release. This one, not so much. I've also released the biceps tendon, which I got a very large fasciculation on this one when I put it in, because he describes pain when pushing, so the biceps was very much involved. Here's a point on the deltoid and another point on the deltoid. So these have all been released really nicely. And then some trigger points on the pec major. And I've also, as I've explained in previous videos, I'm of the philosophy of treating the whole person. So while I focus the mainstay of the treatment on releasing the trigger points, I also do points that are from classical Chinese acupuncture theory. For example, this pain is on this channel here, so I do a distal point, and this also happens to be a muscular tension area. And then this person is not particularly, let's call him Bill. Bill is not particularly stressed out mentally, so I don't have to do any points for that. But I did do, this point, his name is gallbladder 34. And I forget the Chinese name right off the bat, but that's the numbering system. And so this is the master point of all of the fascia and tendons in the body. So when you stimulate this point, then it helps to relax the fascia. So I've done that point, and then I've also done this point, which is a very point that we use to nourish the tendons. So I've done a little bit of classical Chinese acupuncture with him. And I've also, though he's not complaining of the pain on this side, I could feel that his upper trapezius was very tight on both sides. And so I find that if you have, let's say you have a problem on the right shoulder, generally the left shoulder is tight as well. And I'll do a little bit of release on the left shoulder for a balancing effect. And also to, the right shoulder girdle doesn't exist in a vacuum. It operates in conjunction with the left shoulder girdle when you move your arms forward and backward.